Okay, thanks. So I'm also going to be talking about what we learned from the insurer perspective by talking to some insurers in California, specifically about the implementation of SB 600. And my name is Sara McMenamin. I'm an associate professor here in the School of Public Health at UC San Diego. And I'm also part of the California Health Benefits Review Program. So that is a team of UC researchers that the legislature asks to review specific mandated benefit bills to try to interpret what this legislation would do, how would utilization change. So that's actually how I first met Irene Sue, because she was our content expert back in 2011 for the very first bill. And so we analyzed the first bill, we analyzed the second bill, we analyzed the third bill, we analyzed the fourth bill, it passed. And then I would see Irene in the cancer center and she would say, Sara, I don't understand. My patients are still having trouble getting access to the service. What is going on? And so that led us on this journey of the last 5 years of trying to really look at what were the challenges of implementing this specific mandated benefit in California. So today, right now, I'll talk about some of the insurer barriers, and they're sort of echoing what we just heard from Kara in terms of the problems that are specific to California. We talked to 4 insurers in California about their experience, again, specifically implementing SB 600. And there were sort of 3 distinct themes that emerged. So the first one is similar to what we just heard, was that the legislation was vague and difficult to implement. And they sort of felt that it was, the legislation itself and legislators really don't understand how health plans work. They don't understand it enough to write legislation that's implementable. And so that's where the regulator can really come in and kind of translate that with guidance. And unfortunately, there really, wasn't guidance issued in a timely fashion in this regard for this bill. And so, there's very few laws that are, just plug and play from the insurer perspective. So that's a challenge. The second one was in reference to clinical practice guidelines, which I think, in general, everyone thinks is good practice to include that. But the problem is the clinical practice guidelines themselves aren't written for insurers to implement new mandates, new benefits. So they're really written for clinicians. So we can really look to the tobacco practice guideline actually has components in there that are related to the health system and health system change and specific to benefit coverage for tobacco dependence treatment. So in California, for example, when they defined comprehensive coverage, they used the exact language that was in that tobacco cessation mandate. So that's kind of one model that we could use to try to get some kind of translation of clinical practice guidelines that insurers could use. Because it really, still took a lot of translation, and sometimes the insurers didn't feel like they really had the skills to understand how to do that. And then the third theme that we saw, again, was sort of because there was this lack of timely, detailed regulator guidance, insurers were unclear about what to do in terms of what codes needed to be covered, what populations needed to be covered, how much should be covered, how many years of storage, similar to, what Kara shared in terms of Hawaii. And so, again, that's where regulator guidance can really help with some of that. And it was funny because the insurers were also aware of the fact that you have to be careful what you ask for. I mean, maybe you want this really detailed guidance, and then all of a sudden you're complaining about the fact that they're, telling you exactly what to do and you don't have any of that autonomy. But in this case, really having no guidance was really a struggle for them. So some recommendations that came out of this research would be to have, we would love to have, it was hard to find those 4 insurers to participate in our study. We would love to have more study where researchers and insurers are partnering together to try to understand some of these barriers and co-create solutions together to try to understand this sort of black box of policy implementation. And then also policy, including, both legislation and or regulations should include enough detail to assist insurers with implementation efforts. So thank you.